Welcome back to Living Pain Free with Dr. Marc Darrow. We're taking your calls right here at the station at 866-870-5752. That's 866-870-5752. And check out the website at www.lastemcells.com. That's lastemcells.com. And when you call today, you get Dr. Darrow's latest book for free, Stem Cell and Platelet Therapy. And we are speaking with Helen in Los Angeles.
Helen, Dr. Marc Darrow, you're back with us?
Yes, I am, yes.
Okay. So this is a big point. You know, you've got a peripheral neuropathy where the nerves are dying back from, most likely from excess sugar. And what happens is when there's excess sugar in the blood, it gets absorbed by the nerves, and then sugar is osmotic in agent, meaning that when it's somewhere, it will grab water, and then it'll expand the nerves and start to kill them. It doesn't totally deaden them, but some parts of it does. Now, you've been eating a lot of bread, and in a sense, I shouldn't use this word, but I busted you. And I said, are you overweight? And you said, no. And I said, what's your hemoglobin A1C? And you said 5.9. And I said, you're eating carbohydrates. And you said you eat a lot of bread. So I'm just telling the world that carbs are the worst thing we can eat. There was a book I read when I was in Berkeley back in 1970 called The Sugar Blues. And that's a great book because you read it, you're not going to want to eat sugar anymore. And sugar is carbohydrate. Carbohydrate comes in many forms. It comes in grain of any kind. It comes in dairy products. It comes in fruit, fructose, sugar, obviously sugar and alcohol. So if you want to heal up that peripheral neuropathy, you got to get off. If it were me, I wouldn't eat any carbs except dense vegetables. Okay? I would stick to protein, vegetables, and water, and that's about it. Because peripheral neuropathy is not a fun thing to have. I mentioned to you that...
it's very painful.
Yeah, it is painful. It's not just that, but...
The neurologist gave me a gabapentin, and it didn't work. And then he gave me Cymbalta. He says Cymbalta is the best. But these are antidepressants.
The point is this. Why take a medicine when all you have to do is eat the proper food?
Oh. Okay.
You're probably very low in antioxidants also. So
a lot of inflammation I have. Lots of inflammation.
Yeah, that's right. You have inflammation because the sugar raises insulin. Insulin is inflammatory in nature. So we want to keep our insulin as low as possible. Not according to the labs. The traditional labs we get are all off. They're calibrated for basically sick people, for the American population, which is not a healthy population because of the food we eat. Okay?
You know, I'm hungry all the time. I don't know why.
Because what happens is when you eat carbs, your insulin jumps up, and then it puts all the sugar in your blood, all the sugar in your system, into your cells. It takes it out of the blood, and then you get dizzy and fibromyalgia and chronic fatigue. So then you're hungry. So when you eat protein, veggies, and water, you don't get hungry, you don't get dizzy, you don't get any of those things.
So protein is fish, chicken?
All the fleshes, yeah, and there's a lot of proteins if you're vegetarian that you can buy also. There's different protein powders. So I'm going to move on. I'm going to move on because this show is not really at all about what I'm talking about. I'm just trying to help you out. And for those of you who have things that are not musculoskeletal in nature or about growing hair or making the face pretty, which are the things we do with regenerative medicine, then just go to my email, which you can get through the website at www.lastemcells.com. That's www.lastemcells.com. And every single page has a spot to email me, and I will get right back to you. I return every single person's emails that I get all day and all night, and I love doing it. In between patients, I run to my computer and crank out a few more answers. So if you have more questions, Helen, go to the website, www.lastemcells.com. Please cut down or stop the carbs. Like I said, the two main reasons for peripheral neuropathy are carbohydrates and alcoholism. Okay?
Thanks for your call, Helen. Okay, our number is 866-870-5752 right here at the station. You can call right now. I have lines open for you. 866-870-5752. You get Dr. Darrow's latest book for free, Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate. And you can go to the website, www.lastemcells.com, and email Dr. Darrow off of every page on the site, and watch him performing the treatments on video. That's www.lastemcells.com.
Beautiful. I just wanted to mention again the vampire facelift, something you will never forget the name of. It's non-surgical. We inject cells from your body into the face and regrow the collagen and make you look younger, get it back the way it used to look. Also, if you need to grow some hair, it's not going to work on Dr. Phil, but if you want to grow some hair and you're losing a little bit, then come in and we'll inject these cells into your scalp and grow back the hair that way. My book has chapters on both of those procedures, and most of this book is about musculoskeletal issues, how to heal, neck pain, back pain, arthritis, joint, I'll call it joint destruction, bone-on-bone arthritis, which is really not a truism, but doctors call it that to suck you into getting a surgery when you don't need it. I shouldn't say doctors suck you into anything, should I? Well, I find it happening every day, and it alarms me because they need to move ahead in their education and learn how to do regenerative medicine instead of surgery when it's not needed. Yes, surgery is needed many times. We had a woman call in this morning named Marilyn who had a tibial fracture, tibial plateau, and she had surgery, and she needed that surgery. But most of the surgeries that are done for meniscal tears, rotator cuff tears, hip labral tears, bone on bone, which it isn't, arthritis. People come in all the time and go, I've got bone on bone arthritis. I've been to 3 surgeons. They all say I need a joint replacement. I move them around, examine them. I start laughing. They go, what are you laughing for? I go, because you don't need surgery. You just need to do some regenerative medicine, and there's a good chance that we'll heal you up without surgery. We just inject your own cells back into the spot and generate more collagen, which is the main constituent of cartilage, and it can heal muscle tears and rotator cuff tears, which are tendon tears, ligament tears, you name it. So I've been doing this work a long, long, long time. I've been told I do more than anybody else on the planet. I'm not sure if that's true, but I'm a busy guy. I do it every day of the week, and I love it. It's worked on me all over my body. I self-inject. If I tweak myself, I inject myself. And it's worked every time I've done it. Doesn't work on everybody. Doesn't work all the time. But it works. And it's conservative. It's not taking a knife and cutting into your body where you can end up having an infection and having joint replacements that fall out, have to be replaced. Terrible thing, leg length discrepancies. I saw a shoulder replacement where the arm never moved again. All kinds of terrible things I see from surgery. And again, I love the surgeons. I just don't like the surgeries. All right, can I go to... I hear you breathing. Take
I'm
it
breathing
away.
because I want to go to John in Los Angeles.
All right, John, you need some hair regrowth. Ask me your questions.
Hi, John, are you there?
I think I'd like to have grow hair.
Well, do you have some left?
Yeah, I'm losing on the top quite a bit of it.
Okay.
So I just wanted to replace that.
Okay. Well, I'd have to look at you, and if you like, you can go to my website, which is www.lastemcells.com, and email me from there. and then I'll send you back an email, and you can attach a photograph of the top of your head if you like. Just take your cell phone, or you can, let's do it that way. That's an easy way to do it.
All right. I'll do it that way. Thank you.
Yeah, do it that
much.
way, and I can tell you if you're a good candidate or not. If you're to come in, I'm going to do your labs to see if you're low in things like iron or too much estrogen or imbalance with the hormones, testosterone, growth hormone, all those things. And if your thyroid is low, we'll check all that out because those are all potential causes of hair loss. Okay? And then,
okay.
Yeah.
I'm going to get on the computer and I'll send you the stuff.
Okay. How old were you when you started losing hair?
Oh, I think I think like about 58, 56.
Okay.
56. Right
And
down there.
may I ask how old you are now?
No. Oh, yeah. 80 years old.
Okay. Well, you sound great, man. Any body complaints at all? Anything in your body hurt?
No. I function very well, considering my age, I think. But just the hair. Just want to kind of replace that a little bit.
Okay, man. You sound like a young guy, and somebody who's 80 who wants their hair back. There's good hope for that. By 80, the hormones are really out of balance. So.
I see. Well.
Yeah, we definitely want to get your labs done.
Okay, so I get the labs done through you, right, or before I go see you?
Well, no. Well, call the office. The phone number to the office is 800-300-9300. If you like,
800,
we can just
300
800-300-9300.
800-300-9300. Okay.
Yeah, you can call and say we spoke on the radio and you want to have your labs done before you come in. We'll send you to Quest Diagnostics, and by the time you get to see me, we'll know about your labs. Or you can just come in, and then we'll order it then. It's up to you.
I think I'll just come in because I don't know where I would go to get the labs.
No, we'll tell you. That's why you call the office, 800-300-9300. We'll take care of it.
Okay.
We order it for you and set up an appointment.
Thank you.
God bless, John.
Thanks for your call, John. Our number is 866-870-5752. Right here in the studio, we have lines open for you. And let's go see what's going on with Marina in Tarzana.
Marina, Dr. Marc Darrow. God, we got 2 hair loss people in a row, and this is a show on musculoskeletal pain injury. What's up, Marina? You losing some hair?
Yeah, it's my New Year resolution to get my hair back.
Okay. Just like I told John before you, we need to get your labs checked, and you can call the office, set up an appointment. It's 800-300-9300. Come on down, and we'll check you out and see what's going on. But there's good hope using.
To send you my results. I did blood work recently for everything.
Yeah, you can send me the results, but they're not going to be all the labs that I need.
I usually see Dr. Hurd. Do you aware of Dr. Hurd in Tarzana?
No.
Oh, no. Okay. Yeah. I'll definitely. Can you help me with the hair loss? Because somebody told me that I should be doing like a surgery, like moving it from the back to the front. I have it in the front. That's my problem.
Here's my suggestion to you. Call the office at 800-300-9300. You can call them right now. There are people waiting by the phones. Tell them what's up, and they'll get everything lined up for you to help you grow your hair back. You probably do not need any kind of surgery.
Okay. 800-300-9300, right? 800, tell me again.
Beautiful.
800?
800-300-9300. Okay? God bless you, Marina. We're going to move on.
Thank you for your call, Marina. Appreciate it.
Today's a hair day.
I know. That's so funny. I guess
it is.
Sometimes we have different themes on different days. It's kind of funny.
We do. Sometimes it's all the right knee or the left shoulder or something like that.
Yeah. Well, if you're in pain, you want to give us a call. Our number is 866-870-5752 right here in the studio, 866-870-5752. Do you want to take a question?
I would love to talk to you. Please call me.
Yes.
And when you call me, you get a free book, Stem Cell and Platelet Therapy, which I'm holding up to the video camera right now. And I'd be happy to talk to you right this minute so we can answer your questions for free. It's 866-870-5752 at the office. We still have a few minutes left. Please don't wait till the last minute. That's when everybody calls in, and it's too late. So try to get your call in right now. In the meantime, I see we have some callers coming up. I'm gonna answer a question about knees.
All righty.
And by the way, the knees are the first to go. You've heard that, right?
Everybody says that, but
They do.
Is that really true, or is it an old wives' tale?
It's not necessarily true, but for athletes it seems to be. Anyway, this person says, I'm 74 years old, overweight, and have been told I need both knees replaced. Well, come on. Get off the carbs and lose the weight. Your knees will get better on their own, right? I do high-intensity water aerobics 6 times a week. That's good. That means the knees are not bad and you don't need knee replacements. Would love to go back to hiking and dancing like I did so many years ago. Well, there's good hope. We just inject you with some stem cells or platelets or both and regrow the tissue in there and heal you up. Broke my leg about 3 years ago and during recovery gained 40 pounds watching Netflix and drinking wine.
At least
the
they're
following
honest.
year I fell. Yeah, that's good. The following year, and by the way, people come in, patients come in all the time, and I ask them questions. They lie to me because they don't want me to know, and then I find out later. And I can't help you if you don't tell me the truth. The following year, I fell and broke a foot and ended up with a screw. I don't take any prescriptions except thyroid medicine. I wonder if stem cells would help and how much it would cost. For the cost part, go to my website. It's got that information, which is www.lastemcells.com. I'm going to repeat it, www.lastemcells.com, or call the office, and it's 800-300-9300. So we heal knees every single day of the week, all day long. Probably we inject more knees than anything else, but we do the entire body. There's probably nowhere I haven't injected from the top of the head down the neck and back, the hips and knees and ankles and toes to the bottom of the feet for plantar fasciitis. So I do everything, hands, elbows, shoulders, you name it. Most doctors don't know how to do those places. I've been around a long time, about 22 years doing this, and I've injected most parts of my body myself. So all of these things that happened are terrible. I'm sorry they happened to you, but it is good that you're doing aerobics right now. That means your knees are not that terrible, and you certainly probably, when I say certainly probably, who knows? But when someone says they need their knees replaced, you don't look at MRIs or x-rays to decide that. If a person's doing water aerobics 6 times a week, I doubt they need a surgery. They just need to regrow some of the tissue. So I'm hoping you'll come in. I've already written this person an email back, and I think we can help you. I'm waiting for your response. So we have a caller hanging here. Joseph, another hair patient. Oh my gosh. Joseph, were you listening to the other people, John and
Marina?
And Marina, about the hair questions they had, or did you just tune in?
No, I did listen to them, but my question's a little bit different. They were talking
Okay.
or asking about hair replacement. In my case, I'm wondering if it's possible to grow hair in a place that's never grown before. Just between the bottom of my sideburns and then maybe an inch into the beard, I have no hair growth, and I'm wondering if it's possible to somehow fill that in.
It is possible, but I don't do that. You'd have to go to a study at a university or NIH, National Institute of Health or something like that, where they are doing that. I don't do that. If there's no follicles there at all, I don't work at it. So if you've never had hair there, there's probably no follicles there. There are probably people that could do transplants surgically. I mean, do you want to do that for something so simple and it's not really a terrible cosmetic issue? Do you want to consider getting implants for that? I wouldn't.
No, and neither would I.
I do.
Thought there might be a simpler solution, but apparently not.
No, I mean, theoretically, I've never done it. If you want to do it, I would try it. Theoretically, using stem cells, injections, I would try it, but I've never done it before, and I don't know what the results would be. We do know that stem cells can grow back bone and cartilage and all kinds of things, but I don't do that in my practice. My practice is mostly musculoskeletal, meaning the joints, ligaments, tendons, and I don't have experience in injecting areas that don't have follicles. I would certainly try it as an experiment if you want to do it.
Well, I'm not really keen on being a guinea pig, but I will keep it in mind, and I'll go to your website.
Well, the nice thing about what I do is I inject with a very small needle, and it's not like getting a surgery, so there's very little sequelae or side effects to what I do. So that's why I love the work I do. It's so easy, it's so simple, very few side effects. I mean, mainly people get stiff when it's in the joints or tendons or ligaments. For doing hair and face, there's basically nothing to it at all. So God bless you, Joseph. I appreciate your call, and it's probably something you're not going to do, but you can Google that issue, and or if you want to just email me through my website at www.lastemcells.com, I'll do some research for you and see where they're doing that, because I know they're doing it somewhere.
Okay, Joseph, are you there?
God bless you, too. Yes, I am.
Okay.
God bless you, Joseph.
Thank you.
Hey, by the way, Joseph, do you have any pain? Do you have any pain in your body? Any joint, tendon, ligament issues? You sound like you're an active guy.
Well, I'm 70 years old, but yes, I am active. I swim, bicycle ride, walk. I don't run because of my knees, and I have a bad right shoulder from an old injury. But I'm, as I said, 70. I'm 5'5", 130 pounds, and so I keep myself pretty physically active and in good shape.
Yeah, you're perfect. You're perfect. Why don't you come in and let me take a look at your knees and your shoulder? I'm surprised that you called in about your hair when you have knee and shoulder issues and you're an athlete. Anyway, get to the website, www.lastemcells.com, or call the office at 800-300-9300. God bless you all. Thank you, Nita.
Thank you, Joseph, for your call. Thank you, Dr. Darrow. Thank you, Alex. Thank you, Suzette. And listen to our pal Warren Eckstein from 11 to 1 on The Pet Show every Saturday. I'm Nita Valens. We'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.